This is the Pick Your Poison podcast. I'm your host, Dr. JP, and I'm here to share my passion for poisons in this interactive show. Will our patients survive this podcast? It's up to you and the choices you make. Our episode today is called The Hazardous Hike. Want to know what phrase strikes fear into the hearts of toxicologists? What was in the state poison Athens used for capital punishment? And how people become sick after eating quail? Listen to find out. A 24-year-old man presents to the emergency department complaining of weakness and dizziness. He was hiking just prior to arrival when the symptoms began. He felt so weak he required help from his friend to get back to the beginning of the trail. He didn't fall or injure himself, and they'd gone only a mile or two, less than 3 kilometers, through a meadow and in the forest before they turned back. He notes the weather was hot and humid, 100 degrees Fahrenheit or 37.8 Celsius. He wonders if maybe he's dehydrated, though he hadn't hiked far and was drinking plenty of water. He denies medical problems, medicines, over-the-counter medicines and supplements, as well as tobacco, alcohol, and drugs. He's definitely not suicidal. His vital signs are temperature 98.5 Fahrenheit or 37 Celsius, heart rate 95 beats per minute, respiratory rate 24 breaths per minute, and pulse ox 93% on room air. His blood pressure is 125/70. Essentially, he's breathing a little fast, and his oxygen, while within normal limits, is on the low side, especially for a fit hiker. On physical exam, his pupils are normal, as are his lungs and heart. He's able to move all his extremities, but seems overall a bit weak, like he has the strength of a 90-year-old, not a fit, healthy young man. The weakness is generalized, not focal, meaning in all the limbs, not unilateral like a stroke. So in summary, we have an otherwise healthy patient with nonspecific complaints and nonspecific physical exam findings. It's not a lot to work with. Dizziness is the least favorite complaint of every emergency medicine physician. Why? It can mean anything from I don't feel good and have a cold to I'm having a lethal arrhythmia and might drop dead at any moment. Frustratingly, for both patients and physicians, the ED evaluation is often unrevealing. Dehydration is one easy answer for dizziness. Do you think he's dehydrated? Maybe, but I'm not convinced. Certainly, hiking in extreme conditions can result in serious injury and death, but I'm sure many of you have hiked a mile or two in hot weather without requiring an ED visit afterward. What should we do? Let's hook him up to the monitor, check his labs, including electrolytes and an EKG. I'd start here, watch his clinical status, watch the monitor, and wait for the results. I'd order some IV fluids. If in fact he's dehydrated, he'll feel better shortly. Normally, I'd pause here to talk about the differential diagnosis, but right now it includes everything, so instead of wasting time, let's keep moving. After you see a few more patients, his labs come back all normal. His EKG is normal, including the QRS and QTC intervals. The nurse says, I think something's wrong with your guy, the hiker. When you ask what, he says, I don't know, something's just not right. Never dismiss the nurse who thinks something's wrong. Go directly to the bedside. The patient's heart rate is now elevated to 115 beats per minute, despite getting the IV fluid you ordered. His respiratory rate has also gone up to 30 breaths per minute, and despite this, his oxygen saturation is down to 90% on room air. Something definitely isn't right. You re-examine him. His muscles are weak. He can barely lift them against gravity off the bed. And again, it's in all 4 extremities, but worse in the legs than the arms. Putting this together, what do we have? Flaccid paralysis. What's wrong with his breathing, you ask? Well, using the Socratic method of teaching we love in medicine, let me ask you a question instead of answering. What kills you in flaccid paralysis? That's question number 1. A, heart failure. B, arrhythmias. C, respiratory arrest. D, kidney failure. The answer is C. It's respiratory failure that kills you in flaccid paralysis because your diaphragm becomes paralyzed. Remember, the diaphragm is a muscle, and if it's paralyzed, you can't breathe. This is very bad news for our patient. That said, we now have enough to generate a useful differential diagnosis and figure out what's happening. What causes flaccid paralysis? Well, polio, for one, a disease we shouldn't even be talking about because it was almost eradicated, but it wasn't, and it's back. Guillain-Barré syndrome, myasthenia gravis, myelitis. But this isn't a neurology podcast, it's a toxicology podcast, so let's get right to it. We've talked a lot about heavy metals causing neuropathy. This isn't thallium poisoning. The patient doesn't have pain, much less excruciating agony. Could it be lead or arsenic poisoning? Maybe, but it's not likely in the absence of gastrointestinal symptoms, and plus the onset is a little too fast. He was hiking an hour ago, meaning he was fine. And the timeline for heavy metal neuropathy is really days rather than hours. What about a snake bite? Elapid bites cause paralysis, as we discussed on the last episode. The bites can be painless, but the snakes latch on, so I think he'd have noticed. Black widow envenomation occasionally causes muscle weakness, but not in the absence of other symptoms, including severe pain and muscle fasciculations. I love tick paralysis for this, and I'd check every inch of his body, including his hair. If you don't see a tick, you can exclude tick paralysis because the symptoms resolve immediately once you take the tick off. Paralytic shellfish poisoning and tetrodotoxin fit with his symptoms, but it's doubtful he'd be exposed to either on a hike. Same with botulism. High magnesium and things causing low potassium cause paralysis, but his electrolytes are normal. How about curare, poisoning from a blow dart? I love this, it's almost perfect. Indigenous people in the Amazon use the plant to poison blow dart tips for hunting. And in fact, some of the modern drugs we use for paralysis and anesthesia are derived from curare. However, it works very quickly in seconds to minutes, and I don't think he was hit by a blow dart on the hike. The patient's friend arrives and says 3 words that strike fear into the hearts of toxicologists. He was foraging. Uh-oh, hold that thought. The patient's respiratory rate increases, his oxygen drops. Watching his chest rise, you note minimal excursion, meaning despite breathing rapidly, his chest isn't moving very much. It's a sign of impending respiratory failure because his diaphragm isn't working. What's the treatment for this problem? You guessed it, intubation. You put him on the ventilator and send him to the ICU, which at this point must be packed with toxicology patients, given the number we've admitted there recently. With that managed, we can focus on the new information. He wasn't just hiking, but foraging. And why does that strike fear into my heart? Because it's very easy to misidentify plants, resulting in poisoning. Most commonly, people unintentionally poison themselves with mushrooms, but it is far from the only possibility. People trying to consume berries, ramps, leeks, potatoes, carrots, and parsnips, just to name a few, have poisoned themselves. Don't believe me? Well, increases in the popularity of foraging and bumper mushroom crops from damp weather have been shown to increase calls about mushroom toxicity to poison centers. Both photo ID apps and books can lead you astray. And a quick aside here, disturbingly, AI-generated foraging books are on sale, raising concern for potentially dangerous mistakes, so beware. Putting together plants and paralysis, a few things come to mind. First, Jacordi peas, also called rosary peas, and grass peas in a family called Lathyrus, cause lathyrism. They cause a lot of symptoms, including paralysis when eaten. These are well known to be poisonous, but have been consumed in times of famine, for example, as depicted in a Goya print entitled Gracias a la Almor, or Thanks to the Grass Pea. Typically, lathyrism occurs with repeated exposure, not after 1 or 2 bites. Tobacco is another great thought here. Exposures cause paralysis and respiratory failure. If our patient did eat a tobacco plant for some reason, though, he'd probably have to have eaten a large amount. Maybe he was vaping on the hike, but again, he'd have had to have eaten the vaping cartridge or maybe even several vaping cartridges. And while I love tobacco to explain his symptoms, it's not the most likely exposure on a hike. The friend pulls out 2 brown paper bags from his backpack with their finds. The first bag contains 10 mushrooms, all brown. One of my friends recently asked me to identify morel mushrooms from her backyard to let her know if they were real rather than false morels and therefore safe to eat. I told her as a toxicologist, not a mycologist, I'm more useful after you eat the mushrooms than before. Patients often want us to identify what they've eaten, but you need a professional to make the determination with certainty. I don't know what kind of mushrooms these are. I do know this isn't mushroom poisoning. Different types of mushrooms cause different symptoms. The one we worry about most are amanitas, so-called death caps. These cause liver failure, so no, our patient didn't eat an amanita. Other mushrooms cause nausea and vomiting, seizures, anticholinergic toxicity, hallucinations. Again, not really consistent with our patient's symptoms. The second bag contains parsnips, basically white carrots if you haven't seen one. Ever heard of anyone getting parsnip poisoning? No, not from the real ones, but wild parsnips are another story. Why? Because they can be mistaken for another toxic plant. It's time to pick your poison. Question number 2. What did our patient eat? A. Poison hemlock. B. Water hemlock. C. Foxglove. D. Jimson weed. The answer? This is a tough question. The answer is A, poison hemlock. Foxglove contains digoxin, causing lethal arrhythmias. Jimson weed causes anticholinergic toxicity. Listen to the Mad as a Hatter episode for more. Water hemlock causes seizures. So our patient ingested poison hemlock, mistaking the poisonous roots for wild parsnips. And let me try to clear up the confusion between the two hemlocks. Conium maculatum is called poison hemlock, giving our patient the classic symptoms of paralysis. Water hemlock is Cicuta maculata, and it's a totally different plant, as I said, causing seizures. Poison hemlock is a tall plant with white flowers and a green stem with purple splotches. It's a weed originally imported from Europe as an ornamental garden plant. Apparently, it smells like mouse urine, though I'm not sure how many people that description helps. The stem, flower, leaves, and roots are all toxic. It has been mistaken for parsnips, wild carrots, anise seeds, and parsley. And it's often mistaken for the edible Queen Anne's lace. How do you tell the two apart? The purple splotches on the stem, but my advice is don't try. The main toxic compound is conine. And what does it do? Actually, it's very similar to nicotine. It binds to and blocks nicotine receptors in the neuromuscular junction. The muscle can't contract, and the patient develops flaccid paralysis. It's also very poisonous to livestock, causing paralysis and death in cows, pigs, and sheep. So what's the treatment for poison hemlock? It's supportive care. There's no antidote, and it's definitely lethal, but with treatment, specifically mechanical ventilation, most patients have a good prognosis. The toxin itself doesn't last long, and patients receiving timely medical care recover by the next day. There's some very interesting reports in the literature around unusual routes of exposure to poison hemlock. One patient injected a liquid preparation. I don't know if he made it or bought it somehow, but he had very serious symptoms, including a cardiac arrest and prolonged encephalopathy for weeks afterward. Another interesting route of exposure is via quails. I could actually do a whole podcast on poisoning after eating quail called coturnism, described in the Bible and recognized since ancient times. In 1991, in Italy, 17 patients became sick after eating songbirds. It's believed, though it's not definitively proven, that the birds ate hemlock, which then poisoned the patients who ate the birds. 6 patients in the series were paralyzed and 11 had muscle weakness. 4 died. So question number 3, true or false? You can safely transplant the organs of someone with hemlock poisoning. A, true, or B, false? The answer is true. The liver, kidney, and pancreas of a 14-year-old girl who tragically died of hemlock toxicity were successfully transplanted, and none of the recipients showed any signs of poisoning. That leads us right to question number 4. Who famously died of hemlock poisoning? A, Alexander the Great, B, Aristotle, C, Socrates, or D, Julius Caesar? The answer is C, Socrates. Poison hemlock was part of the Athenian state poison used for capital punishment. Hemlock was mixed with wine and sometimes with opium from poppies. Socrates was convicted of impiety and corrupting Athenian youth, and he was sentenced to death in 399 BCE. Plato wrote a description of his death describing the following. The physician poisoner, by the way, not a job description that should even exist, told Socrates to walk until he felt difficulty. This was a common practice to speed up circulation of the poison. Socrates then developed numbness and tingling in his legs, then deadening of his body, traveling up from the feet. Toxicologists and others debate if the drink was really poison hemlock, but I think the description's fairly convincing. Like many other natural poisons, hemlock was used in medicine to treat things like herpes, arthritis, gout, and cancer. Even St. Anthony's fire, according to one source I read. It's kind of interesting to imagine treating ergot poisoning with hemlock poisoning. So question number 5, what disease was hemlock used to treat in medieval times in Europe? A, rabies, B, syphilis, C, the plague, or D, smallpox? The answer is A, rabies. Hemlock mixed with wine and fennel was used to treat it. Partial credit if you said syphilis, because I'm sure we could find that someone somewhere did use it for syphilis, since just about every other potential therapeutic was tried for that disease. In fact, hemlock was listed in the British Pharmaceutical Codex all the way until 1938. So back to our patient. The next day, his breathing returns to normal and he's extubated. You go see him. He's awake with no sequelae. He swears off foraging in the future, though you notice the brown paper bag with mushrooms is still in his friend's backpack. This is a fictional case, as are all our cases, to protect the innocent, but it is based on real poisonings. I want to share this poem by Nicander of Colophon from an illustrated manuscript on plant toxicity from the 2nd century BCE. Quote, "Take note of the noxious draught which is hemlock, for this drink assuredly looses disaster upon the head, bringing the darkness of the night. The eyes roll, and men roam the streets with tottering steps and crawling upon their hands. A terrible choking blocks the lower throat and the narrow passage of the windpipe. The extremities grow cold, and the limbs, the stout arteries, are contracted. For a short while the victim draws breath like one swooning, and his spirit beholds Hades." End quote. It's an amazingly vivid and accurate description of hemlock toxicity. So the last question in today's podcast and today's pop culture consult. In which TV series does a character die of hemlock poisoning? A. Breaking Bad, B. The Walking Dead, C. The Sopranos, or D. Grey's Anatomy? Follow the Twitter and Instagram feeds, both at PigPoison1, and you'll see the answer when I post it. Remember, never try anything on this podcast at home or anywhere else. Thanks for your attention. I hope you enjoyed listening as much as I enjoyed making the podcast. It helps if you subscribe, leave reviews, and/or tell your friends. All the episodes are available on our website, pigpoison.com, Apple, Spotify, or any other location where podcasts are available. Transcripts are available on the website. While I'm a real doctor, this podcast is fictional, meant for entertainment and educational purposes, not medical advice. If you have a medical problem, please see your primary care practitioner. Thank you. Until next time, take care and stay safe.
This podcast is a production of Unfiltered Studios. If you would like to know more about joining Unfiltered Studios, please visit our website at unfpod.com for more information.